Now, what's the difference between what you're using and what all the other hospitals are using?
So the difference really is just the technology that's available. So we have, the more modern the machine, the more modern the techniques are. So we're able to use much more advanced techniques, which allows focused radiotherapy so that patients have less side effects and more accurate dose. South Africa on the whole is not poorly resourced from radiotherapy equipment, but if you look at the rest of Africa, they're using very old-fashioned cobalt radiotherapy machines, which are a very low energy, highly inaccurate, and can lead to much more increased damage and toxicity from the radiation treatment.
When you say inaccurate, what do you mean?
We also have the possibility where you can use CT scans, so through what we call 3D planning. We have highly technical image-guided radiation techniques, so we can be sure every day that we're absolutely on target, whereas in many other centres they wouldn't have access to anything similar to that.
So how did Tygerberg Hospital actually get this equipment?
Well, we were just very fortunate in the fact that, as I said before, the Provincial Department of Health here in the Western Cape has a very on-the-ball, open mind about how important cancer services are, and how it's extremely vital that we stay up to date and provide our patients with the best and the safest and the newest equipment we possibly can. And it was last year that the Department of Health okayed for us to get the new radiotherapy machine.
Wow. Now, do you see more patients because you have this advanced equipment?
I don't think so. I think that because we're a referral centre, patients are just referred from the secondary hospitals around us, from the primary healthcare settings, from as far afield as George and upcountry, and from the very remote regions. So I doubt they'll know that we have this equipment. They're referred simply for their disease.
Now, in your opinion, should more hospitals in South Africa have this equipment?
I think that radiation techniques and development and progression is extremely vital for us all to stay ahead of what's actually changing in radiotherapy. And the bottom line is providing radiation treatment as safely as possible. And this is what the newer equipment allows us. So if at all possible, of course, every radiation department should be equipped with similar equipment. And there are some in the country. Bloemfontein has similar equipment to ourselves as well. I think it's extremely important that we all move forward. Yeah.
Now, you just spoke about the safety of radiotherapy, and we always hear these horror stories of what people who are going through radiotherapy experience. What are some of the side effects that your patients experience?
I think the horror stories are always about skin reactions, and skin reactions are vastly reduced with the modern radiation equipment, and it's extremely uncommon nowadays for people to have a radiation side effect where their skin actually shows nasty changes. It's much more common that people will have side effects that are dependent on where they're actually having their radiation. So if you happen to have radiation, say to your pelvis, if you're a cervix cancer patient, you may have some bowel changes and some nausea, but all of those are highly manageable with medication. So I think a lot of the fear people have for radiotherapy should really be dispelled because of modern equipment and their advances.
Is there ever a time in a cancer patient's time, I guess, that they would not have radiotherapy?
Amazingly enough, there's virtually nothing in oncology that doesn't need radiotherapy at some time.
Really?
Breast and colon cancer, it is a part and parcel of a package with surgery. In the case of cervix cancer, it's often the primary treatment when surgery is not possible, the same for prostate cancer. And then even in patients who have stage 4 disease and are incurable, often would receive radiotherapy for pain or for bleeding or a symptom that we could manage. So virtually every patient that comes through our department will have some radiotherapy at some point.